name is Stephanie Velasquez. Today I'm going to be evaluating a wrist. All right, can I evaluate you today?
Yes.
What is your name?
Glenn.
Okay, and what sport do you play?
Baseball.
All right, and are you right or left-handed?
I'm left-handed.
Okay, and what brings you in today?
I've been having some pain in my wrist.
Okay. And is it like here or lower?
No, I'm having some numbness in my middle finger, as well as like my thumb feels weak.
Okay. All right, so I'm just going to ask you some of your medical history, and then I'll get towards your hand, so you can relax your wrist. All right, do you have any history of any medical conditions I need to know about?
No.
And do you have a history of diabetes?
No.
Any family history of like arthritis or any joint diseases?
Some arthritis, yeah.
Okay. All right, and have you ever injured that wrist before?
No.
Never had an injury to that wrist. Okay. And do you sleep with that wrist maybe on your head or maybe flex like this?
Sometimes, maybe.
Okay. Do you drive a lot maybe where you would have your wrist like this?
Probably not.
No? Okay. And, all right, so recently you've been pitching. Have you been pitching a lot?
Yeah.
All right, and it gets worse or better as you pitch?
Worse.
Pain gets worse. A scale of 0 being no pain, 5 being the most pain. How's your pain?
Right now, about like a 2.5.
All right, 0 being no pain, 10 being when you go to the hospital. Where's your pain?
Probably like a 6.
Okay, and with your wrist being painful, are you having any difficulties at home, maybe like typing or any other activities that might cause you pain?
I guess something along the lines of, say, typing, just because of that numbness in my middle finger.
Okay, perfect. All right, so I'm going to go ahead and start touching your wrist, if that's okay with you. I'm just going to start feeling this. So I'm going to start with the uninvolved side first. So your left side, the side that's bothering you, is this painful for you?
No.
All right, how about this?
No.
All right, so I'm palpating the anterior side and then the posterior side. So palmar side,
no.
Painful? No. And how about this? Can you feel this?
Mm-hmm.
Okay, so I'm going to have you close your eyes really quick. Can you feel this?
Mm-hmm.
Do you feel this?
Yep.
Any abnormal sensations?
No.
Do you feel this?
Mm-hmm.
All right, any abnormal sensations?
No.
Can you feel this?
Mm-hmm.
Perfect. All right, I'm going to do this side. Okay. All right, so I'm going to palpate this. Anterior side, is that painful?
It's just a little numb.
Okay. And do you feel this?
Everywhere but my middle finger.
Middle finger feels numb. All right. And any pain up here in your forearm?
No, just a little tingling in my thumb.
Okay, sounds good. All right, so with this sign and symptom, I'm thinking that you can relax your arm. Maybe it's an overuse injury from the pitching, so he'll have maybe flexor tendon tendinitis. So those flexor tendons with that pitching mechanics might be inflamed, and he's having some compression in that wrist, which could be causing that median nerve to be compressed and that middle finger to have that numbness and that thumb to be weak, like he mentioned. So with this one, I think I will go ahead and start with Phelan's test. So I can have him do this. So put your wrists together like this, hands face down, elbows out. All right, hold that position. Okay, and you can relax. All right, any pain or weakness with that?
Just a little bit, same numbness and weakness.
Okay, you can go ahead and relax. All right, so the next test we're going to do is the Tinel's flick test. So we can do this bilaterally. So I'll look at the anterior side. I'll go ahead and give that a flick, a compression. Any pain or weakness there? All right, and I'll go to the affected side, the left side. Pain or weakness there?
Just my thumb. Okay,
so he does have some sort of sign or symptom elicited with the affected side. So they could indicate that it is a nerve pathology. And like I said, probably due to compression from that excessive wrist flexion in his pitching mechanics. And Finkelstein's. So Finkelstein's is for de Quervain's. So due to the signs and symptoms, we want to rule out an injury to the adductor pollicis or the pollicis longus brevis. So either one of those could be involved right now, and with de Quervain's, we can rule that out. So I'll do bilateral, start with the unaffected side. So we're going to go ahead and do this. We're going to tuck our thumbs, go like this, and we're going to go forward, extend. All right. Pain or weakness here?
No.
And how about here?
No.
All right, so now with this injury, I'm going to check myotones and dermatomes. I'm going to go ahead and start with myotones. So we are going to check the strength in his digits and with wrist flexion. So primarily he says he has thumb weakness. So with the median nerve compression, we can go ahead and do thumb to pinky, and I'll do that bilaterally. So I'll start with the unaffected side. So we're going to do thumb to pinky like this. There we go. I'm going to pull and don't let me break you, okay?
Okay.
All right, good strength there. And I'm going to do index finger and thumb. Same thing. Don't let me break you. Index finger. There we go. Don't let me break you. Good strength there. All right, and we'll do the affected side now. Thumb to pinky. All right, and I can break him. And same thing here. I can break him. So he has weakness in that thumb. And I'll go ahead and go into dermatomes. So go ahead and close your eyes. And I'll do you feel this evenly on both sides?
Not equally, no.
Okay, do you feel this evenly on both sides?
No.
Do you feel this evenly on both sides?
No.
All right, any abnormal sensations here?
Just on the left hand.
On the left hand. Okay, and is it specific? You can open your eyes. Is it a specific finger?
Just like I said, the middle.
Okay, so I'm definitely thinking median nerve pathology for my diagnosis. As a differential, I can say it's carpal tunnels, but I think that is secondary to the tendonitis of the flexor tendons, definitely from that overuse of the chronic wrist flexion in the end of the pitching mechanics. So I can go ahead and check his capillary refill and distal pulse. So capillary refill, go ahead and give me your hands. Awesome, that's within normal limits, which is 2 seconds. And then distal pulse, I'll go ahead and check here. And with a normal, healthy athlete, it will come out to about 60 beats per minute, and he's right on there. And all right, so what I can do with him is short-term goals. We can determine the severity of the injury. We can also treat him for pain. So we can do some NSAIDs, and it'll help with relieving inflammation in that area. Also, we can brace him if it helps to prevent that wrist flexion if he's doing this in his activities of daily living. As a long-term goal, definitely want to work on his pitching mechanics, make sure that he's not getting that chronic injury. In regards to treatment goals and rehab plan, definitely think we can do some therapeutic modalities, some ultrasound. We can even get some e-stim on there, and hopefully we can get the tissues back up to speed and no longer inflamed. Definitely cryotherapy after practices or any activities that's involving wrist flexion. So maybe an easy lift day, but that could still use some cryotherapy, some cold ice modalities. That way we can relieve that inflammation. Another thing we could do is strengthen his wrist flexors bilaterally, and in doing that we can also work in the extensors, and that way it's kind of evening out the strength between the muscle groups. And yeah, that's about it. Thank you.